It changed our whole family. It changed our whole life.
It got real hard for a while.
And my first question was, what is autism? Because I didn't really know what it was.
We really had to learn how to change the way we did everything.
I mean, just straddling, we trying to learn what to do. You know, we had something new we had to learn, you know.
It was kind of hard to realize that I might have a brother that's going to be special, that have special needs and autism.
A lot of sleepless nights because he didn't sleep good.
We can't just pick up and go to a ball game because he has a meltdown because all of those people are there. And it truly has changed everyone's life. Sometimes autism feels a little hopeless. The Thompson Center gave us some hope.
The Thompson Center is unique because we have physicians, psychologists, and behavior specialists all underneath one roof. That allows families to come to one place to get the expertise that they need to care for their child. I'm one of the pediatricians who specializes in autism. I care for kids all along the spectrum of autism, and I also do a lot of diagnosis. The Ray family is one of my families that I take care of. They live about 90 miles from the Thompson Center. CJ is a sweet, wonderful little boy. 90 miles is a long way, though, to have to come to see his doctor.
Missouri is a really large state, and you wouldn't know it when you look on a map, but when you try to get to the outlying parts of the state, it takes a long time.
Driving to Columbia is difficult because, CJ doesn't do well in the car for a long period of time. Clarence and I really both need to go. One of us can entertain him while the other one's driving.
Especially traveling very far, it's a whole day off work.
I teach, so it's not that easy to get off work.
Some children, by the time they get here, because their day has been so disrupted and their routine disrupted, they're pretty out of sorts.
I struggle a lot with what I put him through to take him to the doctor because I'm like, does this baby think that, okay, my mom's supposed to protect me and she's taking me to this place where they're gonna poke and prod me and get up in my face, and I don't like that.
One of the unique opportunities that we have at the Thompson Center is to utilize telehealth.
What telehealth does is it changes the access equation. It shrinks the state so that patients can see their healthcare providers in the urban areas without the long drive. Missouri Telehealth Network helps to provide live, interactive, audio and video healthcare using high broadband video conferencing equipment.
Telehealth is really cool. We're able to sit down in a room here at the Thompson Center. We are able to look at a video screen utilizing a video camera, and I can see my patient as if they were in the same room with me.
It's probably not even 30 minutes for us to drive to Richland to the telehealth. That is a completely different experience for CJ.
If we don't have to drive to Columbia, we keep our routine the same to the most part, which in turn keeps CJ more calm, better in our lives, keeps everything rolling better.
Initially, he's a little wary because it still looks like a doctor's office, but as soon as we get in there and he realizes, oh, she's on the TV, she's not in my space, she's not in my face, it's so relaxing for him.
I can watch them interact with their parent. I can watch them have a lot of fun trying to interact with me on the TV. I can zoom around. I can move the camera. It's a wonderful tool to be able to assess, to treat.
His talking is different. His mannerisms are different. His interaction is different. So she actually gets a true read of what he's like in his everyday life because he's not this ball of nerves the whole time.
So telehealth offers us that ability to actually see them with less disruption to the family and to their routine, which is then in the best interest of the child as well.
The benefit really goes to the patient. It brings the specialty care right to their community.
If telehealth didn't exist, it'd be a lot harder on us.
If I wanted to go to Columbia and see her and take CJ, it's not like that was taken away from me. It's not like they said, you can't come to Columbia because you're using telehealth. So if I ever feel like I need to actually physically see her, where I can actually reach out and touch her, that's there. So I don't really see any drawbacks to it.
The Missouri Telehealth Network, the University of Missouri, and the Thompson Center for Autism and Other Neurodevelopmental Disorders is pleased to be working together to access families all across the state and provide care for children where they live.
Missouri Telehealth Network has used over 40 different subspecialties in telehealth over the past several years. We do telehealth for children, adults. We even do telehealth into nursing homes. What I really hope to accomplish is for people to understand the promise of telehealth and how it can change how healthcare is delivered.
CJ's life may be different because of the resources that they have available to us.
It's healthcare provided at the right time, at the right place, with the right doctor.